The flu, something many of us have had in the past. It's a contagious respiratory disease which can cause mild to severe illness and even death. I'm Grace Trafton of The Better Part. Stay tuned and find out what you need to know about this virus from an expert source. Our guest, Dr. Karen Molander, is board certified in emergency medicine and is the recipient of several professional awards and honors while practicing medicine in Silicon Valley. Welcome, Karen.
Thank you for having me, Grace.
Tell me, first of all, what exactly is the flu?
Well, the flu is also known as influenza, and it's a respiratory illness that can cause high fevers, severe dry cough, body aches, and malaise.
So how do I know that I have the flu instead of the cold or something else?
Well, both are transmitted the same way. You know, if oftentimes you are the recipient of an errant cough, and both the flu and the common cold are entered into your respiratory system by you rubbing your eye or touching your nose or touching your mouth after a respiratory droplet has flown your way. And what happens is typically a cold will infect only the upper respiratory system. So it causes pretty bad sinus congestion, runny nose, and a cough. But it doesn't typically cause the high fever, the body aches, and the generalized malaise and misery that most people feel accompanies the flu.
So there are some subtle differences, and maybe having a fever might be one of the clues.
The fever is one of the predominant clues, and typically with a cold, you still feel like you're able to function. You just feel like you have a foggy head. But with the flu, you are ready for bed and you need to rest.
Now, I thought the flu only happened in the winter. Why am I still hearing about cases now and then?
Well, part of it is because of our wonderful international travel. So July is the time for winter in Australia, for example, but it's summertime here. But someone who's flying from Australia to the U.S. can easily pass that wonderful flu virus to everybody in the airplane.
True.
And they can send it all across the U.S. So that's one of the reasons why we're seeing less of that seasonal nature to the flu.
Now, are there different kinds of flu?
There are. There's 4 different types of flu. There's influenza A, influenza B, influenza C, and influenza D. Now, the reason we don't hear about influenza C or D is because they either don't cause infections in humans or it's so mild that we don't really feel horribly. Influenza A and influenza B are the ones that we really worry about.
And what exactly is avian flu?
Avian flu is a form of influenza A. And the original carrier or vector of influenza A was wild fowl, so swans, geese, terns. And what happened was these wild fowl end up transmitting it to chicken farms, and it's kind of notoriously known for having occurred in China, Hong Kong in the past few years. And that form of avian flu, when it went to the chicken farm, all of a sudden, a sick chicken gave it and passed it to the farmer, and it was virulent enough that it can cause pretty bad illness at times in humans.
Now, did this happen just within recent decades?
We did have a bad bout of the avian flu in the past. I think it was 10 years ago. I'm not honest on the exact dates. But there was a pretty bad outbreak where they had to kill off most of the chickens in China to try and prevent further spread.
Now, what do they mean when they say H1N1, H3N2, all sorts of these H's?
So the virus that, has different identifiers on it. One of them is called hemagglutinin. The other one is called neuraminidase. And the H stands for hemagglutinin. The N stands for neuraminidase. And there are, I'm blanking, I think it's 18 forms of hemagglutinin and 11 of the neuraminidase. Yes, just have to check my notes. I want to be keeping myself honest here. And so those help identify how each of those viruses are independent of one another. And the way that the CDC tracks what virus is causing illness. So for example, if we have an H1N1 outbreak and it started in Akron, Ohio, they'll call it H1N1 Akron and then talk about the year that it was first identified, 2017. Now I'm making that up. I don't know if there was an outbreak in Akron in 2017, but that's where they first noticed the new form of the virus emerging. So that's how they identify it.
So there are some treatments for the flu, isn't there?
There are. So there's 3 different antibiotic or antiviral medicines for it, and they're easiest remembered by their generic name or by their brand names, much catchier. Tamiflu is one of them. There's a generic form of that called oseltamivir. And then there's another one that is available in an inhaled form called Relenza. And then a third one that's available in an intravenous form, meaning going in the vein, and that's called Rapavir, I believe. Yeah.
So how effective are these treatments?
It depends upon who you ask.
Oh, really?
If you're the person who's suffering from the flu and you're told that if you take a pill that you can diminish those symptoms by a day, you're pretty eager to get a hold of that medication. The standard information that we have available to us from the CDC website recommends that if you start Tamiflu within 2 days of onset of your symptoms, that it can reduce the symptoms by a day. But that was based on data that was published by the pharmaceutical company that manufactured Tamiflu. So after the large 2009 pandemic of H1N1 flu, there was an independent research group in Canada called Cochrane Research Group that wanted to figure out if Tamiflu was truly effective for H1N1 or not, and tried to obtain the unpublished data from the pharmaceutical company in addition to all the published data. And it took many years, many requests, lawsuits, public outrage to try and get all that data released. And Cochrane said that there was little value to Tamiflu, that it did not seem to help the symptoms. But if you go to the official CDC website, they still recommend that we administer it to people who are at high risk of severe illness and possible death. And the people that are usually at higher risk of dying from influenza are pregnant women, are people with chronic respiratory illnesses like asthma or COPD, also known as emphysema. So those, or people who have a compromised immune system.
So are you saying that the unpublished data show that it really didn't help that much?
It was not supporting the use of Tamiflu.
Oh.
Yeah, according to the Cochrane review.
But the CDC is still recommending it.
CDC still recommends it. And I think part of it is when you have that critically ill patient who is at the hospital where you're trying to help them improve. You're giving supportive care. You're giving Tylenol, ibuprofen for the fever. You're giving IV fluids for the dehydration. But you're trying everything you can to try and make this pregnant woman healthier. So you give the Tamiflu or the Rapavir, the IV form. Yeah.
And should I be getting antibiotics if I have the flu?
No, absolutely not. The flu is a virus, so you need antiviral medications. Antibiotics we use to treat bacteria. That's why it's antibiotic. And so if you get unnecessary antibiotics, it may cause increased resistance if you're ever exposed to that bacteria again. I think I've told you this before on our sepsis segment, but we have more bacterial cells on us and in us than human cells.
Right.
So every time we're exposed to an antibiotic, we can kill off our good bacteria in our gut and cause problems with diarrhea. We can expose our body to antibiotics that we don't need, and that bacteria can build resistance. So when our immune system weakens and that bacteria decides that it can grow at a greater rate, it can cause more severe disease.
I think we're having, a worldwide problem of the overuse of antibiotics, isn't that right?
Yes, we've had some challenges. One of the biggest challenges that we've seen is an increase in a very dangerous infection called Clostridium Difficile. And that's bacteria that exists in the human gut, normally a very, very small population. But when we kill off our good bacteria by taking an antibiotic, that bacteria takes over, and it can cause a pretty severe case of diarrhea, sometimes with mucus, sometimes with blood. It can make people very dehydrated. People can have significant weight loss associated with it. And the challenge is that the antibiotics that we're developing to combat C. difficile are becoming less effective. And there's forms of that bacteria out there that are resistant to every antibiotic we have.
So what are the symptoms of C. diff?
Severe abdominal cramping, for example, nausea, not really as much vomiting, but mostly predominantly the bad diarrhea.
And so it sounds kind of scary, the C. diff.
Well, it can be. The other challenge is that this is a pretty strong bacteria. It can live on a handrail, it can live on the floor, you know, which is why hospitals see a challenge with this. You know, sick people go to hospitals, sick people get antibiotics.
Right.
C. difficile sometimes can manifest itself in hospitals. And one of the challenges is the way that you have to clean a hospital room from C. difficile is bleach and pretty intensive cleaning that needs to happen.
Now, do hospitals do that periodically?
Oh, most definitely. Yes. It's
on a regular basis?
It's part of the protocol. They have to do it. Yeah. And there's ways, fancier ways that they have of detecting bacterial load. Now they're using UV light, for example, to see whether there's a significant bacterial load in a portion of the hospital.
Now, besides hospitals, are there other places that C. diff is prevalent?
Well, it's pretty rare. It's typically found where people have a weakened immune system. I've heard of a few cases in daycares, for example, where you're dealing with small children who might not have a fully developed immune system, who may have gotten antibiotics for an ear infection, for example. But for the most part, it's usually transmitted, or people get it transmitted from hospitals, or people can get it after, for example, having extended antibiotics for a tooth infection or for a respiratory infection.
Now, what are the best ways of preventing C. diff?
Not taking antibiotics unnecessarily, completing the antibiotic regimen that you've been told to by your doctor, and making sure that you wash your hands very well and that you try not to touch your mouth with your fingers as much as possible. And avoiding hospitals if you don't need to go there when you're feeling ill.
Right. So are probiotics helpful at all?
I do recommend probiotics. If someone is on antibiotics, I recommend that they take probiotics during the antibiotic and even for a few weeks after that, just to help your gut recover. Another natural method of returning those good bacteria to your gut are to eat fermented foods like sauerkraut or kimchi, or to eat yogurt or drink kefir yogurt. Yeah.
And are there other medications I can take for influenza?
So when we were talking about influenza, we were talking about how it's really important to help manage the symptoms. So Tylenol and ibuprofen will definitely make people feel better because their temperature won't be so high and so miserable. So when you have a temperature of 103, you don't want to move much. But if you can get that back down to 98.6 or 99, you can actually get up, stand up, drink water, function. So trying to get the fever managed. You can also take cough suppressants, for example. One of the most wonderful natural cough suppressants we have is honey. So your grandmother was right. You know, honey with a little warm water and lemon is a great way to help control cough. We don't recommend honey for children under age 1, just because, again, their immune system's not completely developed and there's tiny little botulinum spores in there that can cause problems for them.
Yeah, I've read, in fact, that Manuka honey from New Zealand is particularly high in antibiotic elements.
So it's because it's unregulated, for example, there's not very many good studies done on the benefits of some of these more natural methods of controlling cough, because it's hard to get the makers of Manuka honey to agree to do a double-blind placebo study, published in the New England Journal of Medicine, comparing that to guaifenesin, although they should think about it.
Yes.
But pharmaceutical companies, for example, have a lot more money and a lot more influence.
Right, right. Now, since we're talking about cough syrup, why are there black box warnings about cough medications for children?
So in 2008, I believe, the FDA decided that it's not safe to give cough medications to children under age 2. And then the pharmaceutical industry voluntarily said, don't give it to children under age 4. And part of the reason they were doing that was because there were a number of accidental deaths associated with the wrong dose of the cough medication being given to the child. And part of it is because, the parent might try brand name cold and flu, #1, like Tylenol or whatever the case may be, and then try Advil cold and flu, not realizing that there's duplicate amounts of other cough suppressants in there, like guaifenesin, dextromethorphan, or phenylephrine, which can cause the heart to race. Yeah.
So why is it so important for us to get the flu vaccine?
Because that's the best way not to get the flu. One of the challenges is the flu kills still a number of people per year. So the CDC, if you look in the past decade, they say anywhere from, I think it's 13,000 to 45,000 people are killed from the flu each year. So if we can try and eliminate that, fabulous. The challenge is that other things you can do to try and prevent yourself from getting the flu is wash your hands, cover your mouth. If you have the flu, don't go out. Don't go to Trader Joe's or Safeway or to the movie theater. Stay home and rest. And washing your hands frequently. Hand sanitizer will work for protecting you from cold and flu virus.
Okay, so that's good to know. So hand sanitizers can work.
For cold and flu.
For cold and flu.
Yeah.
So overall, how would you rate the effectiveness of flu vaccine?
Well, unfortunately, that varies from year to year. So some years we get it right. So how we figure out how to base our flu vaccine is what the previous year's flu was. Okay, so for example, if last year the flu was H1N1 and H2N3, and then they might pick 2 forms of influenza B as well in the quadrivalent vaccine. There's also a trivalent vaccine that has 2 forms of influenza A and 1 form of influenza B. And if they didn't get it right, or there was a year where there was what we call an antigenic shift, where the flu all of a sudden got super smart, mutated in less than a year, and became resistant to that form of the flu vaccine, then that year the vaccine won't prove effective. And so people get frustrated because they went through the pain and misery of getting the flu vaccine, and then they still ended up with the flu. So last year we had a little bit more flu exposure because that was a case where the vaccine didn't provide complete coverage, but it provided partial effect for people.
So what are some of the most common misconceptions about the flu?
So I think one of the challenges is that they think that they get the flu from the vaccine. But in reality, when you're getting the vaccine, what you're getting is, if you're getting the injection, you're getting a dead vaccine that has just portions of the influenza virus. But it's enough to tell your body, I need to build antibodies up to these different forms of the flu. And if you're getting the live virus, which is inhaled up the nose, that is a live virus where all the, how do I want to say this? It's called attenuated, where all the evil parts of the virus that make you feel lousy no longer exist on that live virus. So it's kind of, less virulent form of the virus. And your body, again, builds up antibodies to it to help fight it off, okay? So the challenge is in both cases, your immune system needs to ramp up. And one of the ways you feel that immune system ramping up is you might get some inflammation at the injection site. You might have a little redness there. You might feel some aches and pains as though you have the flu, but a much milder form of it. So that's one of the challenges. And then the other challenge is where we need to get our flu vaccine is where people go who have the flu.
Right.
So if you're going to your doctor's office to get the vaccination or going to a pharmacy, you might be getting exposed to someone there who has the flu who's not yet manifesting the signs of the flu. So you can go 1 to 3 days carrying the flu virus and not have the symptoms.
And not know it.
Yeah.
I've heard of something called a Fluzone high dose. What is that exactly?
So that's a high dose quadrivalent, so 1, 2, 3, 4 forms of the influenza virus, so 2 influenza A, 2 influenza B, but a higher amount of that virus, what we call the antigen. So it's more likely to cause side effects. Again, the redness at the injection site, the headache, maybe a low-grade fever, maybe some body aches, sore throat, than the regular Fluzone injection. But it's recommended for the older patients because their immune system is not as efficient as an 18-year-old's. So they need a little bit more exposure to that antigen in order to ramp up their immune system to fight off the virus.
So are older people getting Fluzone high dose on a regular basis?
It's a relatively newer vaccine, but it is recommended.
It is recommended. Mm-hmm. Why do we need to get a flu vaccine every year, but we don't have to get a pneumonia vaccine or shingles vaccine every year?
Well, because the flu virus is darn smart. It can mutate much more effectively and much more rapidly than the pneumococcal bacteria, and much faster than the shingles virus.
So if you can't get the vaccine, I understand that people who are on chemotherapy or have an allergy to the vaccine, of course, shouldn't be getting it. What can you do to prevent contracting the flu?
So you bring up a really good point. So people who have an egg allergy, for example, are encouraged not to get the injectable form of the flu vaccine. And they do shy away from the nasal spray form of the vaccine for people who have asthma or COPD. The best way to try and prevent yourself from getting the flu is that family member that wants to visit you that has a fever, runny nose, and a cough, say, can we reschedule
Right.
for next month?
Right.
Keeping your mouth covered, not touching your eyes, your nose, your face, washing your hands frequently, getting enough sleep, and eating healthy. Those are all wonderful ways to try and keep your immune system in as best shape as you can.
So there was a story about World War I. Is it true that more people died during World War I from influenza than from warfare itself?
You're absolutely right. If I have my numbers correctly, it was over 60,000 soldiers died from disease that year, and it was less than, I think it was around 53,000 died in combat. But the thing that was most shocking about the Spanish flu of 1918 was that it infected over 1/3 of the population of the world.
Oh my goodness.
Yeah, over 500 million people ended up contracting the virus. And this virus was really, really sneaky because it killed about, the estimates are off because it was a time of war and not most people weren't keeping track of what people died of because everything was such chaos during that time period.
Right.
And the other challenge was there was also suppression of the media in terms of releasing how many people were dying from illness versus warfare. But they think that anywhere between 10 million to 50 million people died from the virus that year. That was one of the most incredible outbreaks of the flu. And the challenge with that was that year the flu was so strong it really affected the typical young patient. So all these 18-year-old new GIs were transmitting the virus to one another at Army bases across the U.S. and across the world.
So do they know what accounted for this phenomenon?
So it was one of those, what I was talking about, the antigenic shift, where all of a sudden the virus mutated and became extremely strong and extremely virulent and would cause these young 18-year-olds to really ramp up their immune system and get very sick. And the other challenge was during that time period is once you got hit with the flu, your immune system was already knocked down, and then you would get a bacterial infection. So that would be a case where I would give antibiotics to somebody who's had the flu and now has a bacterial infection. But that would be
so
the
how
only
do you
case.
know that?
So now we have the benefits of a lot more testing than we did at that time. So there are certain tests that we can get in the emergency department and in the hospital to try and check and see if someone has both a viral infection and a bacterial infection. And also to see how sick they are, to see if they're septic.
Now, how did the 2017 flu season compare to World War I?
Oh, it was much milder. You know, the CDC has to publish when there's pediatric deaths from influenza, but they don't have as much data when it's related to anyone above age 18. But still, typically, again, it's like 10,000 to 40,000 deaths per year, versus in the Spanish flu, 1918, I think the statistic was over 350,000 people died.
Oh my goodness.
From the flu that year.
Is that right?
Yeah, in the U.S.
So not too long ago, we had done a show about sepsis. And remind us again, what is sepsis, and can the flu cause sepsis? So
sepsis can only happen if you have an infection, and it's your body's overwhelming response to that infection. And sometimes that response can be so strong, it can be life-threatening. And that's when people develop what we call septic shock. So influenza definitely can cause sepsis. Bacteria can cause sepsis. Fungus can cause sepsis. Parasites can cause sepsis.
Is the stomach flu the same as influenza?
No. So the stomach flu, the most common cause of the stomach flu is a virus called norovirus. And this is a pretty tricky virus too, because it cannot be killed by hand sanitizer. And so it is a virus that causes intense stomach cramping, nausea, vomiting, and diarrhea. It's a short-lived illness, but boy, you feel miserable, especially on day one, and can go for about 5 days. And you can use significant amount of fluid. So it can be very dangerous in the older population and in very little children. And it loves confined spaces. So it can go through a child care center very quickly.
Oh.
It can go, this is the virus that you hear about on cruise ships. Just because it is so resistant to being killed and can live on surfaces there. And you really need to clean up after the person right away. And again, clean the area where the person might have had, you know, emesis or diarrhea with bacteria, with a bleach substance, so that you can kill that virus.
Well, thank you so much, Dr. Molander. You have given us a wealth of information today.
Thank you.
Thanks to Dr. Molander, I think that we're now better prepared for the next flu season. Thank you for being with us today, and please remember to also watch us on YouTube and Roku. See you next time. Bye-bye.